Acupuncture is my life. Acupuncturemylife. Let us begin.
Hello everyone, and welcome back to my show. I'm Dr. Lott, your host and educator from Acupuncture is My Life. Now, in this week's interesting case of the week, I will be discussing diarrhea. I will say to you, as well as I tell my patients, if you're experiencing extended bouts with diarrhea over a period of 2 days or more, please consult with your primary care physician. Now, diarrhea is characterized by changes in the frequency and quality of bowel movements. This disorder is defined by the frequent passage of unformed, loose, and watery stool that may or may not contain undigested food. Now, diarrhea can occur at any time of the year, but it tends to be more likely to occur during both the summer and fall seasons. Its pathophysiology is usually tied to excessive dampness, spleen and stomach dysfunction, impairment of the large intestine's transporting function, and failure to separate clear and turbid substances in Chinese medicine. Now, its etiology and pathogenesis in Chinese medicine can be related to 1, exterior pathogenic factors, and there are 6 exterior pathogenic factors that can induce diarrhea, especially cold, dampness, summer heat, and fire. The exterior influences can have a direct impact on the digestive system and may disturb the functions of the spleen and stomach. Now, the spleen prefers a dry environment and it dislikes dampness. Now, 2, improper diet. Now, eating too much can obstruct the stomach's capability of receiving and ripening, which leads to the impairment of digestion and absorption. Now, in addition to that, the consumption of raw food and contaminated food may directly injure the spleen and stomach and impair the ability to transform, transport, ascend, and descend stomach qi. Now, emotional stress, which is tied to liver qi stagnation in Chinese medicine, is usually caused by excessive anger and long-term frustration, which tends to overact on the spleen, leading to secondary spleen qi deficiency and impaired function of transformation and transportation. And 4, deficiency of the spleen and stomach, which is due to overexertion, irregular diet over a long period of time, and chronic illness can exhaust the spleen and stomach as well. The deficient stomach receives food but is not able to decompose it, and the deficient spleen is incapable of transforming and transporting food into essence. Now, the consequence to that is the pure and turbid combine and drain out together as diarrhea. Now, 5, yang deficiency of the kidney. Kidney yang deficiency, which is generally caused by chronic illness, degeneration is an elderly and constitutional weakness, will fail to warm the spleen yang. Now, this does not only impair the spleen's function to transform and transport food and water, but it also hinders the kidney's function to control bowel movements, thereby inducing diarrhea. Now, when it comes to my interesting case of the week, my patient was diagnosed with stagnant liver qi overacting on the spleen. We have to keep in mind that we live in a very stressful society, which tends to affect a lot of our choices and how we tend to take care of ourselves. So it's very important that we try to find a balance in our lives to offset some of the stress in which we face on a daily basis. Now, there are acupuncture treatments that can assist you in dealing with stress. Now, when it comes to my patient, he was experiencing recurrent painful diarrhea induced by emotional strain, abdominal pain temporarily relieved after bowel movements. Now, his symptoms were distension and stifling sensation in the chest and hypochondriac regions, belching, and poor appetite. His tongue was slightly red and his pulse was wiry. So I knew I had to pacify the liver, soothe the qi, and strengthen the spleen. Along with recommending a Chinese herbal formula, my point prescription consisted of Ganshu, Xingjian, Intang, and Tai Chong. And after just 2 treatments, my patient stated his bowel movements were more formed and consistent. I recommended that he continue seeing me for treatment to balance out his stressful lifestyle, and he agreed. Now there you have it, my interesting case of the week. Now don't forget to subscribe to my show, and until next time, acupuncture is my life. What's yours?